Thank you. And welcome everyone to our webinar, Engaging Members in Plan Governance During COVID-19, a panel discussion. My name is Alana Noor and I'm with the Lewin Group. Today's session will include presentations, followed by a panel discussion and live question and answer with presenters and participants. The session will be recorded and we'll be posting a video recording along with today's slides at resourcesforintegratedcare.com. The audio for the presentation automatically streams through your computer. Phone lines are also available. You can access the number by clicking the black phone icon at the bottom of your screen. This webinar is supported through the Medicare and Medicaid Coordination Office at the Centers for Medicare and Medicaid Services. MMCO is helping beneficiaries dually eligible for Medicare and Medicaid have access to seamless, high-quality health care that includes the full range of covered services in both programs. To learn more about current efforts and resources, please visit our website or follow us on Twitter for more detail at @integrate_care. At this time, I'd like to introduce our moderator for today. Renee Marcus Hoden is the Deputy Director of Community Catalyst Center for Consumer Engagement and Health Innovation. For the past 20 years, Renee has worked to bring the consumer perspective to the forefront of health and health innovation. Renee?
Thank you, Alana, and welcome everyone. I'm so pleased to be with you all today for this webinar on member engagement and plan governance during COVID-19. As Alana mentioned, I'm with the Center for Consumer Engagement and Health Innovation at Community Catalyst, a national healthcare advocacy organization working to elevate the voice of consumers in health and healthcare. And I've had the wonderful opportunity to work with the Lewin Group and with the Medicare and Medicaid Coordination Office over the last several years on a variety of webinars on the topic of member engagement, including a 3-part series we did last year in 2019 on member engagement in plan governance. And I encourage all of you to visit after the webinar the Resources for Integrated Care website that was referenced just before this to access those webinars. I also wanted to share that this year I had the pleasure of facilitating the inaugural Integrated Care Community of Practice, which was a learning community of health plans, each of which serve low-income older adults and people with disabilities. The community of practice participants were plan staff that hold responsibility for incorporating meaningful member feedback into their organizational governance structures. And we met over 5 months to share challenges and promising practices. Interestingly, we launched the community in March, just as we were all thrust into this new world. So engaging members while adhering to physical distancing protocols were very much top of mind for participants in the community of practice, and we were all learning together and in real time, so to speak. So in today's webinar, we'll share those lessons. So now I first want to take a few moments to introduce today's speakers and offer a roadmap for our time together. We'll start out with brief overviews, as Alana mentioned, from each of our 3 organizational representatives. First, we'll hear from Robin Rohr from CareSource in Ohio. Robin is a Senior Consumer Insight Manager at the plan, and in that role, she's developed and maintained a robust member advisory committee program across multiple markets and lines of business. Robin was a speaker at one of last year's webinars, and then she served as guest faculty member for the community of practice earlier this year. Next, we'll hear from Natalie Wang from the Scan Health Plan in Southern California. Natalie is a project manager in the Healthcare Services Department at the plan, working on projects related to seeking member feedback and insights and addressing social determinants of health. Natalie is responsible for running the member advisory committees and ensuring that insights from those committees are incorporated into various initiatives and programs. She also runs the plan's community-based organization advisory committee. Natalie was a member of our community of practice, and so we're happy to have her join us today. Next, we'll hear from Monica Gossett from UCare in Minnesota. Monica is the community outreach manager at the plan. She's served as the lead for multiple member advisory committees, and she oversees the community relations team that promotes UCare products and services at over 300 events each year. She also manages the UCare Foundation grant process. Like Natalie, Monica was a member of our inaugural community of practice. I'm also thrilled to share that we'll be joined today by Mary Harmon, who is a member of one of the CareSource member advisory committees. And we will introduce Mary a bit more later in the program. Thank you all of our speakers for being with us today. Why don't we go to the next slide. So here are the learning objectives for the session today. By the end of the session, participants should be able to identify strategies for engaging member advisors using phone or video conference platforms. They should identify strategies for overcoming the digital divide for member advisors who either lack that necessary technology to participate or who might be unfamiliar with how to use it. And then finally, participants will be able to identify and access specific tools to use in supporting member engagement in plan governance. Let's go to the next slide to talk about the agenda. Very quickly, we'll start as we typically do with some polls to get a sense of who's in the audience. Then we'll get brief overviews, as I mentioned earlier, from our 3 organizational representatives. Robin will start, followed by Natalie, and then Monica, and each will share with us information about their organizations and the structure of their advisory committees so that we all get sort of a baseline understanding of what things looked like before the onset of COVID-19. The bulk of our time today, however, will be spent in a conversation that I have the privilege of moderating among Robin, Monica, Natalie, and Mary, in which we'll be talking about how they've pivoted their approaches since the onset of the pandemic. Following that discussion, we'll leave plenty of time for questions and answers from all of you. And then finally, of course, we ask that you stay on very briefly to complete an evaluation of the webinar. Those are very important to us. Okay, let's go on to the polls and get a start to understanding who's with us today. So as you'll see on your screen, the first poll is asking, what setting do you work in? Which of the following best describes your professional area? I'm sorry. I believe the first one you're seeing actually is about your professional area. So if you can just check off which one describes it best, so you have only one, even though many of you probably have multiple roles. We'll just give it a minute. Okay. Why don't we go to the results and see who is with us today. Okay. So based on our results, we have majority of participants from health plan administration or management, followed by what looks to be health plan case managers or care coordinators. But we have a sprinkling across the various categories as well. Okay, let's go to the next slide, please. Okay, now we'll go back to that other poll. So let's find out what setting you work in. So again, one choice. You can choose the best answer. Again, many of you may operate in multiple settings, but if you can pick the setting that best describes where you work, we'll give everybody just a few more seconds to make their choices. Okay, why don't we take a look at the results? Okay, not surprisingly, since we heard who the health plan management or administration was the most popular choice among the professional area, the vast majority of you are in health plans, followed by, again, a sprinkling across the board, but you know, including consumer organizations, community-based organizations, long-term care facilities. Okay, well that's great. It sounds like we've got you know, our target audience for sure, but also folks that may be able to learn from our speakers today and then take those lessons out into the community or whatever other setting you work in. Okay, let's go to our next slide. And I'm going to turn things over to our first speaker, Robin Rohr from CareSource. Robin.
Thanks, Renee. Good afternoon, everyone. As Renee mentioned, I'm Robin Rohr. I'm a Senior Consumer Insight Manager with CareSource. I've been in this role about 7 years, and most of that I have been a part of managing our advisory council. Next slide, please. CareSource has been around for about 30 years, the majority of which we've been serving low-income populations, primarily Medicaid. Within the last 7 years or so, we've also moved into the health insurance marketplace space, as well as Medicare Advantage, as well as our dual-eligible population that we refer to as our MyCare plan. We serve members in Georgia, Indiana, Kentucky, Ohio, and West Virginia. However, our dual eligibles, our MyCare members, are only in Ohio. So overall, we have about 2 million members, 30,000 of which are our dual eligible MyCare members. Next slide, please. At CareSource, I'm part of a consumer experience department. We focus solely on member and provider feedback and insights. We get this feedback through a variety of channels. We do a multitude of experience and satisfaction surveys throughout the year. We've also, within the last few years, introduced a private online feedback community, which has been fantastic. We're able to do real-time surveys. We can do discussion boards. We've even recently started introducing video focus groups, which have been fantastic. We also have a very robust advisory council program. So we've done it at a variety of different approaches throughout these years, but within the last 4 years or so, we've landed on a kind of a model where we have established groups of members who attend quarterly focus group style meetings. We find doing established groups of members really help us build on learning from quarter to quarter, and it also helps us work collaboratively with those members in driving improvement strategies and projects that we eventually roll out throughout the organization. So we get these different feedback insights through these different channels, and then we roll it out not only to those areas of the business for whom the topics might be relevant, but we also roll it out across the entire enterprise. So all of our advisory council summary reports are shared out across the entire company. And then we work collaboratively with the business leaders and business owners throughout the different areas to improve member experience, satisfaction, and health outcomes as well. And then we also do ongoing surveys and different feedback projects to help us determine the effectiveness of these action plans over time. So we're also measuring efficacy as well. Next slide, please. So as I mentioned, the advisory councils for the MyCare dual eligibles are held only in Ohio. We have 3 regions that we serve in Ohio, and we do quarterly 90-minute in-person meetings with these groups and these regions. We have started leveraging in the last few years an outside third-party market research vendor to help us with our efforts. We not only do these for our MyCare population, but we also do them for the majority of other plans and products too. So as many of you know, these are very labor intensive and they really take a lot of time to do them correctly. So we found that leveraging a research vendor to do more of the administrative tasks, such as the RSVPs and the invites and follow-ups for the meetings, has been really kind of a game changer in making sure that our attendance is there and that we can spend our time in a little bit more kind of the value-added areas. In addition to our MyCare members, we also invite a host of other employees from CareSource too, business leaders, our MyCare leaders, in addition to care managers. They're able to really help with a lot of the kind of in-the-field type questions, and also serve as kind of the easy button if members are having any challenges that day. We also invite community advocates and ombudsmen to each of the meetings. So out of all the feedback channels that we use throughout CareSource, I just want to wrap up by saying I really feel that the advisory councils probably provide us with the richest and most robust feedback that we get throughout of all of our other channels. And I feel that they really provide a lot of those aha moments that we might not get through our surveys. And they've probably driven some of the most, I'd say, impactful improvement strategies throughout our organization. So I will pass the ball to Natalie next.
Thank you, Robin. Hi, everyone. Again, I'm Natalie Wang, Project Manager with SCAN Health Plan. Next slide, please. So a little bit about SCAN. We are a Medicare Advantage health plan headquartered in Long Beach, California. Our mission is always mission has always been keeping seniors healthy and independent, and our vision is that SCAN Health Plan is truly the best choice for seniors. We are a 4.5-star plan, which we are very proud of, 3 years in a row, and we serve mostly Southern California, but we have a few service areas in Northern California as well. So we are a growing plan, and we currently have 215,000 members, and across our membership, we have around 14,500 SNP members. So with our SNP lines of business, we have the dual SNP, chronic condition SNPs, and institutional SNPs. Next slide, please. So at SCAN, we have various ways of learning about our members so that we can best serve them. And of course, at the base level, we do rely on member data provided by just the regular streams, so claims, enrollment, et cetera. But we've also implemented other assessments and surveys, one of the main ones being our health risk assessment, or an HRA, which is essentially a survey that focuses on health status, access to health care, and then identifying social determinants of health barriers that our members may be facing. So we have questions about transportation, housing, food, social isolation, and other questions on urinary incontinence, falls risks, etc. We also engage members in various activities to learn more about their experiences with healthcare, and then particularly with SCAN, and then just generally learning about their healthcare needs. So these activities include surveys. So these are surveys on top of the HRAs. We have focus groups, interviews, and then of course, our main event, the member advisory committees, which I'll talk a little bit more about on the next slide. So we use data and insights gained from all of these different streams to just better understand the needs of our members and make sure that anything we create has the member voice in mind. It's honestly an ongoing effort to create programs and initiatives that are in line with the members' needs and something key to our mission. Next slide, please. So at SCAN, as Renee mentioned, we hold two types of advisory committees. We have our member advisory. So for our member advisory committees, which you'll see on the left side of the slide, we invite members to come to our headquarters in Long Beach. So these are typically in-person meetings, but of course we've shifted them all to online, which we'll talk to in the panel discussion. And each meeting is held on a specific topic. So for example, last year we held a meeting on the topic of technology, and then another meeting on the impact of pain on quality of life. So these meetings are typically 4 hours long, with breaks in between, of course. And then we have anywhere from 16 to 30 members in participation at each meeting. Our main goal for the member advisory committees are learning from our members' experiences and doing our due diligence to incorporate their feedback and what we learned from the session into our initiatives and programs. For our community-based organization advisory committees, the structure is similar, but here we invite representatives from various organizations to come to SCAN, and it's typically a 4-hour meeting that's also held in person. Similar to the member advisory committee, each meeting is held on a specific topic. So last year we held a meeting on the topic of housing and homelessness. So our goal was really to understand the meeting topic through the eyes of our participants, which are, our community-based providers, as well as the seniors whom they serve. So all of the participants who come across Southern California, we have anywhere from project managers, case managers, to members of the C-suite attend these events. And all of these organizations either have a program that serves seniors, or the organization is dedicated to serving seniors. So this is a great opportunity for us to also identify ways that SCAN can better collaborate with our community partners to deliver coordinated services to our SCAN members and to really make sure that we're not doing anything in a silo. And now I will pass it over to Monica at UCare.
Hi, thanks, Natalie. Again, I am Monica Gossett, and I'm the Community Outreach Manager at UCare. UCare is an independent nonprofit health plan, and we're located in Minneapolis, Minnesota. We provide health coverage and services across Minnesota and in the western part of Wisconsin. We work in partnership with healthcare providers and community organizations, and our members consist of individuals and families enrolled in Minnesota healthcare programs, such as Minnesota Care and medical assistance, Medicare-eligible individuals, adults with disabilities, individuals and families choosing health coverage through MyCare, our insurance marketplace. We currently have over 500,000 members, and we focus on making health coverage simpler and easier to understand. We work to expand access, and we always try to go the extra mile. Just a note about the bike in the bottom right corner. That is our staff on the 5-seat bicycle. We do ride it, and it's been all over the state of Minnesota, and we've even ridden it on a frozen lake in winter. Next slide, please. UCare believes that member feedback helps us build a strong plan. In addition to the member advisory committees that I'll discuss in the next slide, we have a few other ways for our members to get engaged. The Ambassador Program is for those members who want to share positive UCare experiences with others. They share stories online through video, photos, social media posts, and participate in person volunteering at community events with us. We currently have over 600 ambassadors. Champions are UCare Medicare members who want to affirm the value of their coverage and services to legislators. They receive information about legislative matters affecting Medicare. Champions are sometimes invited to personally express their views when we have meetings with our Minnesota congressional delegation and policymakers. The member feedback community is an online-only group where members share their views on health plan experiences through surveys and focus groups. Next slide, please. We currently have 5 member advisory committees, one for each of the products we offer. Members are recruited from across the state to represent both rural and metro areas. The Senior Member Advisory Committee consists of 20 or more Medicare members, and the committee membership stays the same for several years. The Member Advisory Committee is made up of our Medicaid members. We currently have 18, and they too serve for several years. Our MSHO Member Advisory Committee is made up of dual eligible and Minnesota Senior Health Option members. This membership is highly diverse, and we recruit new members for each meeting because we hold our meetings with one diverse population at a time because we usually need an interpreter. Our Disability Advisory Committee includes FNBC and DSNP members, along with care coordinators and other community advocates, and they serve for several years. Our Individual and Family Committee has members who have purchased their insurance on the exchange. This committee has varied ages, from people in their 20s to people in their 50s. Most of our committees meet 3 to 4 times a year. At these meetings, members receive updates from UCare staff on product development, benefits we're thinking of putting, enhancements, marketing plans. They see marketing advertisements and commercials before anyone else, legislative developments, and other special events and activities we think would be of interest. We really encourage and expect our members to ask questions, give direct feedback on their topic, and share their experiences. We report this information to our board of directors on a regular basis, and it's also shared across the organization to various departments. We hold an open comment time at each meeting where members are welcome to ask a question or share a comment about a topic that may not have been on the agenda. They receive a stipend or a gift card for attending. Information is heavily weighed in our decision-making process. If we bring a wording of a newsletter we're going to put out, a flyer, and they say, well, this doesn't really sound right, or we don't understand this, we definitely take their advice and we change it and try to make it better. Member advisory committees are important to us as the input and feedback from these meetings provide us with better understanding of our members, and they help us to improve our plan and our services. Now I will pass this back to Renee.
Great. Thank you, Monica. And thank you all, Robin, Natalie, Monica, for providing us with really great background about your organizations and about the way that you solicit member input in your governance structures. Those presentations really provide a perfect launch pad for our next section, in which we're going to discuss how each of you have pivoted your work with your advisory bodies since March. But before we get started, as I promised earlier, I want to introduce Mary Harmon and welcome her into the conversation. Mary is a resident of Youngstown, Ohio, and is retired from a career in clerical and office work. Since she's retiring, she's been doing a lot. She's been volunteering at a senior center, offering her computer skills to help older adults, other older adults, and she has started a small business making jewelry, flower arrangements, and other knickknacks. Mary has both Medicare and Medicaid and is a member of CareSource's MyCare Ohio plan. And most importantly for this conversation, she has served on the CareSource Member Advisory Council since 2019. So welcome, Mary. Glad to have you in the conversation. Great. All right, well, let's get started. I'm going to start off, even though I said I was going to pivot to, the COVID-19 era, I thought it would be helpful for us to just understand a little bit more about your methods for gathering member feedback before COVID. So for our health plans, let's get started. And just I wanted to ask you all for maybe one challenge you encountered, and on the other hand, maybe one strategy that worked well for gathering member feedback from your advisory council, again, pre-COVID-19. So, Robin, why don't we start with you, then we'll go to Natalie and then Monica.
Sure. Thanks, Renee. So I think as we were developing these councils, our biggest challenge revolved around recruiting members and getting sufficient numbers to attend the meetings. We started out with a lot of different strategies, our care managers doing personal invitations, but we found that the invitation net just wasn't quite wide enough to get enough members in the room for the meeting. So we started casting a wide net by inviting a large random group of members that we mapped by address to be near our meeting location. This also really helped us get a diverse group of members as well, so different ethnicities, some members with disabilities. So we've got a really diverse group by doing that. We also, in our invites, instead of doing it in a corporate way on letterhead, we developed some more warm and fuzzy fun invitations that looked more inviting. It also caught their attention, and I think it let them know that this isn't just a kind of a intimidating corporate type environment, that it was something that they might want to enjoy being a part of. So I think that was really successful. We now have landed on actually having to sometimes turn away a lot of extra people who are saying, hey, I want to participate too. We are forming new advisory councils to accommodate some of those individuals. We find if the room is too full, if we have 30 people in the room and we're trying to do it in the focus group style, it's just not conducive to getting good feedback from everybody. So doing these virtually, which we'll talk about in a little bit, has also helped us kind of cast out our net and be able to include a lot more members as well.
Great, thanks. Natalie, same question to you.
Sure. So at SCAN, we want to make sure that our meetings include members that are representative of our population, and we do have a lot of Spanish-speaking members in our membership. So one challenge that we faced was getting Spanish-speaking members to attend our events and to make sure that we provided enough accommodations and resources and tools to make sure that they felt included and comfortable in our meetings. So to make sure that we had Spanish-speaking members represented, we conducted outreach and recruitment in Spanish with our member services department, and we basically pulled language preference data from our system to identify our outreach population. So then we did outreach in English and Spanish kind of separately. And then once we got members to attend, and they were so happy to have outreach in their language, to have all of our forms and documents in their language as well, which was mailed to them, we then held the meeting. We hold some meetings in both Spanish and English at the same time. So we have English speakers and Spanish speakers in the same room. And for this to all work, we have one bilingual facilitator and then one bilingual staff that's just helping to translate throughout the event. It's important to note, though, that translation does take a lot of time because you're essentially doubling the time of the regular session. So to make sure that we weren't going over our time, because our events are already 4 hours long, which is very long, what we do is we start the first hour of the meeting as a large group discussion with everybody. So that means we have our bilingual facilitator and bilingual staff translating every word that's spoken. And then for the next hour or so, we will break out into small focus groups to do our activities and other small, more focused discussions. And we'll put all the Spanish speakers in the same group so that they can completely speak in Spanish. And then we'll have our translator and facilitators helping to take notes and document things. And then at the end of the session, for the last hour or so, the full group will come back together to review kind of all the feedback that we had received.
Wow, that's a really involved strategy. Thanks for sharing that. Monica, why don't we turn to you and ask the same question of you about, challenges or strategies that worked, again, before COVID?
Yes, so we have faced challenges engaging the diverse populations of our dually eligible members at member meetings. We've been having difficulty with our non-English speaking members open up and give us their thoughts and opinions. So we asked a Hmong colleague to attend an advisory committee that we were going to be having for Hmong members. The staff member, she identified a gap, and so we typically, what we would do is we would give members a Target gift card for attending as an incentive and then provide a snack of fruit and cookies. Our staff member suggested instead we provide a gift card to a more culturally relevant place, a place where these members would actually shop. So we arranged with a small Hmong grocery store to provide $50 store credit for the members, and then we brought a bag of rice and offered persimmons, which we were told was a special treat for them. By shifting this thought process to consider what our members would appreciate, we immediately noticed a greater openness and a willingness to answer our questions at that meeting. For example, when we asked if they used our customer service line before, they would say yes, but really not give us any further information. After we changed how we how we brought things to them and how we approached them, they opened up, and in that meeting they told us they were actually confused by our customer service line questions where it would say press 1 or press 2, and they would usually hang up and not complete the call. So since we have made this change, we have tried it with other groups, especially specifically Latino and in our Somali member populations, and have seen similar improvements.
Wow, that is fantastic. Thanks for sharing the very kind of culturally appropriate approaches that you used. I wanted to turn to Mary now, and again, we're still talking about before COVID, and maybe if you can just give us a little bit more information about how you came to be involved in the Member Advisory Council at CareSource, and a little bit give us a feel for what your experience was, again, before the pandemic hit.
Yes. I received an invitation in the mail and was curious to find out what that was about. So I answered yes. They sent me an invitation. I attended the meeting, and I found it extremely interesting to be able to ask questions about the health care that I was receiving, and also to hear questions from the other people who were on this members advisory committee, and it helped open up more thought process in answering questions and also giving experiences that I had. So that was my experience before, and it was very helpful.
Great. And can I assume that you were attending meetings in person before the pandemic hit?
Yeah. I'm sorry. Yes. Every 3 months, I would go to the meetings, and find them very interesting and very helpful. Look forward to them. To not only ask questions that were related to me and what I was going through, but also giving information that I found out during those 3 months to share with them. Also, as Robin mentioned, they would invite different people to come in to help us understand what their programs were for seniors. So that was also extremely helpful.
Wow, thank you. Really appreciate learning what your experience was like. I'm going to shift gears over to our current environment, which we've been alluding to throughout the presentation so far, and talk about how life has changed with respect to, gathering member input. So obviously, so much of our daily lives has changed since the onset of the pandemic, And again, I wanted to start with our representatives from the plans and ask how you have pivoted to stay connected with your current member advisors since March. So why don't we start with Natalie here, and we'll go to Monica next, and then Robin.
Hi, so this is Natalie. For SCAN, the advisory committees are structured a little bit differently in that we get a new batch of members. We recruit for a new batch of members for every single meeting that we hold, and each meeting, again, is around 20 to 30 members. So we're doing this to make sure that we expand our member reach and get input for more members. So after every single meeting on a certain topic, we will come together internally and we'll discuss all the feedback that was received, and we'll organize them into things that we learned, things that we can actionize, and things that maybe we should plan for in the future. And we'll put it together in kind of a nice summary or a paper, and we'll mail it out to all the members who participated and then disperse it within SCAN internally as well to the different departments. So we still do this. We still conglomerate all of that information, but we do rely on mailing and email now to get the word back out to members and make sure that they're in attendance and that we have their correct information. And during COVID-19, the plan is still doing all of these activities and engaging members in the same way, but recruitment and the format of meetings look a little bit different because everything is done either telephonically or via Zoom.
Got it. Okay, thanks. I think we'll have an opportunity to dig into that just a little bit further in a bit. But Monica, why don't we get an overview of how things have shifted at UCare?
Yes, so most of our member committees are the same people at each meeting. Since we switched to the teleconference format, it has been difficult to speak to members informally like we used to before and after the meeting. We miss the personal touch that in-person meetings used to provide. I try to contact each person individually by phone or email prior to our meetings, our virtual meetings now, to check in with them for a few minutes, see how they're doing, focus some time just on them, and get a chance to chat. Before COVID-19, we always provided members with lunch at in-person meetings. So now we send a $10 gift card for a restaurant with a personal note inviting them to have lunch on us. Sometimes we also send a small gift or trinket with the materials we are sending out before meetings. For example, this month we're sending UCare branded face masks to our senior advisory members.
Oh, that's super creative. That's great. Some of these things are hard to do, to continue doing, when we're following physical distancing protocols. But it sounds like you found some really terrific ways to keep it going. Robin, how about at CareSource? Let's just get a little overview of how you've made the shift.
Sure. Similar to Monica, we do have those established groups, as I mentioned before, and we've really created a great bond with them. I think everyone really looks forward to meeting quarterly and getting together, not only with the CareSource folks, but with the other advisory council members as well. So we were a little bit worried that would be difficult to continue once we were trying to go for, through a social distancing approach. So we do also, we were really concerned too that the meetings need to be tech savvy to still connect was going to be a problem with these members because we do know that a lot of them lack basic computer skills. So we were really worried that we'd lose this connection. However, I'm really happy to say, and I'll talk a little bit more about it later, but we were able to pull these meetings off virtually very successfully. I think we really haven't skipped a beat. It's been a fantastic way for members to gain some, even some new skills that they may not have had in being able to connect virtually with even not so much just us and the other council members, but also with friends and family as well. Also, between the meetings, we do make phone calls and send emails to each of the council members about 3 weeks prior to the quarterly meetings. So we do this to check in with them, to make sure things are going okay for them, and to also ensure that they're aware of and have what they need prior to the next meeting. And so we found the last 2 quarters when we've done these virtually, we really haven't missed a beat, and we've really been able to maintain that close bond with these groups and get the same amount of feedback that we were in person. So we're very pleased with that.
Oh, wow, that's great. Thank you, Robin. I appreciate that. And, not missing a beat is somewhat the topic of our next discussion, which is just digging in a little further. It sounds like the shift to virtual engagement has been fairly smooth for you and potentially for others. But I think we know it's not necessarily the case for everyone, especially members who have limited resources or if they're older adults who may or may not have the same level of experience with the technology, or even those who don't have reliable internet access. And so I'm hoping we can just dig down a little bit further and talk about some of the challenges you've encountered since pivoting to these online platforms, and then how you overcame them. Why don't we start with Monica here?
Well, we've definitely found out that it's not a one-size-fits-all situation. Different people have different comfort levels with technology and are working with different technology. Some people have phones, some people have computers, some people have iPads. Some of our older adult advisory groups are not comfortable connecting with video. We encourage them to, so we offer a practice session for members who are less comfortable and unfamiliar but still want to try the virtual format. So a day before the meeting, we have a practice session. Members can call in, get connected. They can get any necessary troubleshooting help that they need. Not all our members are comfortable even with this option, so we have now send out all our handouts and all our materials in paper form before each meeting. So the members who are calling in still have everything in front of them. We've also provided tablets to some of our lower income members for their use during COVID so they can connect remotely. We, again, work with these members to get up to speed on how to use the tablet. I mean, it's a challenging time, and we still want to connect, so we have to, change the way we are looking at doing things and making sure that they're getting all the information they can from our presentations and meetings.
Great. Thanks, Monica. It sounds like preparation and backup and training, and even in some cases providing the actual technology. So lots of different ways to overcome challenges. Robin, let's return to you. You said not missing a beat, but I assume it wasn't just magically happening, that you took some steps to make that happen.
Sure, it was definitely a lot of extra effort, but similar to UCare, we did have concerns about making sure that those members who are less comfortable with technology could still be able to attend and engage in the meeting. So we did leverage a Zoom platform. So while a lot of the members we were hoping would join by video, and most of them actually are, we did want to make sure that those members who still weren't comfortable with joining via smartphone or computer would be able to engage, so we do allow them to join via phone only as well. And similar to Monica, we do send, if we're going to be reviewing materials, which we'll be doing for Q3, we're sending those ahead of time with our reminder invitations to make sure that they will also be able to participate equally as those who are on video. The other thing that we did, and Renee will be able to share this with all the participants as well, is we developed a very comprehensive step-by-step instruction packet to help those members feel more comfortable with accessing the virtual meeting. So we developed something that had screenshots of exactly what they'd be seeing for all the different options, if they were joining via phone only, if they were joining via a tablet or smartphone, or if they were joining via a laptop or PC. So we had each of those three options, and it really did help make sure that those members were able to connect. We had very few problems with members connecting, actually. The one thing we did also do is we had a troubleshooter on the line who was available. So if someone who had RSVP'd to the meeting had not joined in the first few minutes, that troubleshooter outreached to that member and helped them connect. So I think every meeting we'd have one or two people that did need that extra help connecting. So I highly recommend doing that as well to make sure that all the members who would want to come are able to successfully connect. I'll pass to Natalie.
Thank you. So SCAN is a Medicare Advantage plan, so most of our membership are seniors, 65 and older. And so we had to keep this in mind for our going to an internet platform or Zoom, particularly to hold our member advisory committees. And so we typically in our in-person meetings have around 25 people members in attendance, but we decided that that would just be too many for us to be able to use a Zoom effectively and be able to troubleshoot the issues that the participants are having while they're online. So we decided to hold multiple smaller meetings in lieu of one large meeting, where each meeting has about 3 to 5 members instead. So this way, we also have our troubleshooter, similar to what the others were saying, on the line, so that we can help troubleshoot those 3 to 5 members at the beginning of the meeting. And in order to reach our previous participation numbers, we're holding around 5 smaller sessions rather than the 1 4-hour session. So in order to participate in the Zoom meetings, members do have to have internet access or cellular data, and they have to have a smartphone, computer, or tablet, or anything that can basically access the application. We're still in the testing phases, so we just held our advisory committee via Zoom, and we didn't have any issues, but we're also testing other ways to connect with members, and especially for those members who maybe do not have access to reliable internet or tablets or an iPad or a smartphone at that. And so we are also doing one-on-one telephonic interviews with members. So that means they just have to have a phone or a way to get on the line. And what we'll do is we'll have only 2 SCAN staff on the other end of the line, so 1 note taker and 1 facilitator, and we'll just do a really deep dive interview on the topic at hand.
Wow, that's a big pivot to these individual conversations. So I appreciate hearing about all of the things that you all have done. Just going back to what Robin said before about some of their the plans that they put together to get their members comfortable accessing the virtual meeting. Just getting a little bit of feedback there. I just wanted to note that, as Robin mentioned, we will be providing access to that template set of instructions that CareSource put together. I know it was very helpful to folks in our community of practice, and I think it'll be helpful to participants on this call as well. That'll become available. But I did want to just, test out with Mary about how the shift to virtual engagement has gone for you.
Well, for me, it was extremely smooth. I am very familiar with computers. I'm not an IT person, but I am very familiar. Plus, as Robin mentioned, the information that they sent to get into Zoom and be a part of the meeting is very clear, very, very easy. Also, I am a person who I am not afraid to ask for directions and information and walk me through it to make sure I'm doing it correctly. So I did that. There was always someone available, very knowledgeable, very kind, very patient. So again, for me, it was very smooth to make the transition from, face-to-face meetings to doing the virtual engagement. Yes.
That's great. You mentioned the step-by-step instructions that Robin had talked about earlier. You said that they were helpful. What about them made them helpful? I just think it's worth diving into the details here.
It's a small booklet. That's how I look at it. It is page by page, step by step, not only words but also visual. So they have pictures to show you what the screen should look like.
Oh, that does sound really useful. And I would imagine, given your background in, that you've been helping older adults at the senior center, that might be sort of a familiar approach to you.
Yes. Visual, as you know, is important. Everybody is not able to just follow directions in Word, but when you have that visual aid there, it is definitely helpful. Absolutely. You know what you're looking for.
Great. Well, thanks so much for your feedback on that. I wanted to shift gears one last time before we open it up for questions to see, we've talked about, how it's gone, what you've done, all the creativity you've put into making this work. And I guess I would say, none of us would have ever wished for the pandemic to have happened, but I am curious to hear from each of you about whether there have been any opportunities that have opened up because of the shift to physical distancing protocols, and whether there's been any, positive impact on your member engagement and plan governance. So again, why don't we'll start with Robin, then maybe to Monica, then to Natalie. And then we'll give you, Mary, the final word. Robin?
Yeah, thanks, Renee. I do feel that it is opening the door for us to be able to connect, especially with some of our newer plans who have, not quite as many members in them, especially in those rural areas where there might be not a very dense pocket of members around and a specific meeting location to do in person. So it really does open the door for easily connecting with those members who might be in those more rural areas. The other thing that it allowed us to do in our last 2 quarters is add some long-term care members who are part of our institutional population. So in the past, it was difficult for them to get to those in-person meetings, but we were able to add a couple long-term care members to each of our councils in each of the 3 regions this last time, and it was great. They had some really great perspective from their side, from an institutional side, so that was definitely one of a perk out of the whole thing about having to go virtually. The other thing that I did notice is some of the members who tend to be a little bit more introverted and less likely to speak up at the in-person meetings did seem to participate a little bit more. We do the feedback kind of in a round robin, and they did seem to have a little bit more confidence in speaking up and taking their turn, and I think they could kind of formulate their thoughts ahead of time while everybody else was weighing in as well. So it did engage those more introverted members a little bit more readily. And I do want to also add, though, we want to ensure that those members who are a little bit more introverted aren't feeling pushed too far outside their comfort zone. So I think there's a fine balance between, calling all those members when we feel that they're comfortable in sharing, but also giving them the stage that they may not have as readily stepped forward to in person. So, Monica?
Yes, I would echo what Robin is her answers are very similar to us too. Location is not an issue right now, so we have the opportunity and the potential to reach out to members across the state to participate in these committees because they were in person, and in Minneapolis that was difficult for them in the past. Now they're online, and it opens up a lot more opportunities for them to attend and for us to engage more members. For some of our members, transportation was an issue, even though we offer the transportation reimbursement. The virtual option has resulted in greater buy-in from members because they can, like Robin said, participate even though they may have been more uncomfortable in person, but being in their home in a situation where they are comfortable, they are more willing to get engaged, and it takes some of the fear out of it for them because they're not having to do it in person. At the same time, we still have to find ways to connect with all those members too, because it's easier to sometimes connect in person when they're sitting across from you, but virtually we work really hard to make sure we try to hear from everyone.
Thanks, Monica. Natalie, any thoughts about, new opportunities perhaps?
Yeah, I definitely echo what Monica and Robin have said about expanding our reach to rural areas and being able to shift to virtual meetings to accommodate more people. One thing that I think another opportunity that arose for SCAN is because we are doing those one-on-one interviews, we're doing sessions that are only 3 to 5 members. We are finding that we are getting to go much deeper, we are able to dive much deeper into our members' experiences, their suggestions, their thoughts around healthcare, around their providers, around the plan, and we're getting a lot more rich information and context from our members in that sense. It's true, though, it does take more resources to hold these kind of more one-on-one experiences, because it takes more staffing, a lot more planning, more time in general. And so while this approach has allowed us to really learn more per member, we do have to take into account that it takes more resources. So we've been trying to have a balancing act between the two. But I definitely say an opportunity that has arisen has been the amount of information that members are willing to share when they feel comfortable and when they feel like the plan has 100% of their attention on the member.
Thanks. As I said, Mary, you get the final word. So what has been kind of the silver lining, if there has been one, for you during this period?
Well, it has been even though this is a tragic reason for us being virtual, it has been a help for me. I had an accident during this time. Someone hit me and left. And I had everything on my insurance except for hit and skip. So I don't have a car right now. Okay. And I did get hurt. So it's difficult for me to get on the bus. Mm-hmm. So by this being virtual, I don't have to worry about trying to get a ride to the meetings. I'm able to, participate in each quarterly meeting, which I'm grateful. I hate, that we're in this pandemic, but on the other hand, because of this pandemic, I am able to, again, be able to participate in all the meetings. So that really touched my heart for the people who were struggling to get to the meetings, having, to have caregivers bring them or get rides with other people. It made me more mindful of, how blessed I was before, having my car and just being able to get in and come and go.
Wow, I'm so sorry to hear about the accident. But it's a really poignant thing to realize that you can still participate in these meetings. Yes.
I wanted to add that I noticed that, as Robin had mentioned, that a lot of the people who participated in the meeting, not everybody is very vocal. Some people just are quiet. But during these meetings now, in the comfort of their own homes, whether they're in the Zoom meeting face-to-face or they're on their phones, a lot of people are participating more. They're speaking out, asking questions or addressing concerns. So I think that that's very interesting. I wanted to make sure I brought that up.
Wow, that's a very interesting observation, coming from you as well. I feel like we could have called this webinar, Making Lemonade, based on the conversation we just had. It's not easy, of course, to deal with what we're dealing with, but it sounds like, the experience of the plans here and the experience of, Mary, taking advantage of what the plans have put together has been both interesting and positive in a lot of ways. And I really wanted to just lift up how important it is, as you guys have said, for plan representatives to just spend the time to check in with people, because everyone's going through a lot right now, and I think it means a lot in terms of, building that bond, as someone said earlier, and maintaining that bond, just to check in how people are doing, because it is tough. So I just wanted to thank you all for the conversation. It was so terrific to hear from all of you. We're going to shift gears now, and instead of me asking the questions, we're going to take questions from our participants, and I know that they've been coming in throughout. So I'm going to turn the program back over to Alana, who's going to moderate that section. Alana?
Great. Thank you so much, Renee. And thank you, Monica, Robin, Natalie, and Mary, for sharing all of your insights. We do have a few minutes for questions from the audience, so thank you to everyone who has already submitted questions, either through the Q&A feature or when you registered. If you have additional questions, you can submit them using the Q&A feature on the lower left of the presentation screen. You can type your comment at the bottom and press submit to send it. I will start then with some of the questions we've received so far. Mary, I'll start with you. I'm really glad to hear, I'm very sorry to hear about your accident. I'm really glad to hear that you have been able to continue to attend virtual meetings with the CareSource Member Advisory Council, and it sounds like things are mostly going well. As other plans are thinking about how they can shift to virtual councils or how they can do that well, do you have any recommendations for other plans?
Well, I did hear the person speaking before you say that Robin will be sending the information on how they send out pre-meeting directions. So that is a big deal. I promise you, whoever receives those will be very pleased at how they set it up to walk everybody through to be able to get in to the virtual engagement. So I think that'll be helpful.
Thank you so much, Mary. Yeah, we're very glad and very grateful to Robin and CareSource for sharing that. That is available, and we sent it out in the chat. It's also on the webinar page where everyone went to register, so you have that as a resource, and so glad to be able to share that. I'm really glad, Mary, that that's been helpful for you, and especially all those visuals. Those are really helpful.
Yes.
All right. I'm going to turn to a question about recruitment. So if this goes to Robin, Natalie, and Monica, for all of you to answer, if you have recruited new members during COVID, how have you handled orientation or onboarding to your advisory committee? And Natalie, maybe I'll start with you, as I know you have been bringing new folks on.
Yeah, thanks for having me. So we have been recruiting a few batches of members. And what we're doing is we are sending all onboarding information via email and then also via mail. So we do have a new member orientation packet that we send out to members. And this just includes, what our expectations of them are, how to be a good listener, how to participate, what kinds of things might be discussed, et cetera. And we modified it a bit to make sure that, it still encompasses the virtual format. And then we mail that out to members. But then also just to make sure that they show up and that they are aware of when their session time is, because now we have multiple sessions. We do send out multiple emails to them, just reminding them of when their session date is, letting them know that if they'd like to reschedule, they can do that. And then a few days before their session, we email them the Zoom link.
Thank you, Natalie. Robin, maybe I'll go to you next.
Sure. I think in addition to sending them the materials that they need, we do outreaches via phone to those members just to consult with them a little bit, have some conversations. A little bit more informally, we have not added the same number of members. As I mentioned, we only added a few long-term care members to our recent council. So it was easier to do more personal outreaches to them, consult with them, talk with them individually a little bit about what to expect, how to be a good participant, and also, how to connect, and also, again, those skill sets for being a good member advisory council participant.
Great, thank you, Robin. And Monica, if you've recruited new members, how have you handled orientation or onboarding?
I'm actually just right in the middle of that right now, and what we're doing is same as Natalie and Robin, sending out all the materials in paper form, but then I am meeting with them one-on-one in a Zoom type call so that they can see who I am, I can see who they are, and I get a little chance to get to know them a little bit before the meeting. I can run through how our meetings usually go, talk about the people who will be attending, and just tell them some other agenda topics we've had in the past and how we've used what we've learned there to change so when they come in for the first time, they feel a little bit more comfortable with what's going to happen, and they kind of know how the agenda is going to go, and this is how the meeting runs. So that's what we're doing.
Great, thank you. Natalie, a question for you. So you are doing something a little bit more unique with these one-on-one interviews that Scan Health Plan's doing. Do you have any tips or recommendations for other plans who might be interested in trying a similar approach?
Yeah, so I mean, definitely 100%. You should find a way to record the call and go through compliance and all of that to make sure you have the right disclosures to say at the beginning of the call. But what we do is we have 2 or 3 scan staff people on the line as well, but we're only having one scan staff person, facilitate the event and ask the questions so that people aren't talking over each other, because there's no video. So telephonically, it can get very messy if you have more than 2 people speaking at one time. And then the other people on the line are note takers or are looking things up if the member has specific questions, things like that. And then another thing that we decided to do, and we normally do this for our regular events, is have an agenda with all of the activities, and for the telephonic interview portion, we decided to just have a bunch of different discussion questions and then kind of offshoot questions from the larger general topics, so that we can guide the conversation and kind of make it natural. But then we ensure that that the facilitators knows that they can go off script if the member is going into an area that maybe we hadn't thought of. So then my tip for all the other health plans out there is to just make sure when you're creating your discussion guides and you're training your facilitators to make sure that they're using, 6th or 5th grade level or lower language, just so that you have smooth communication with your members and you're not being intimidating to them.
Great. Thank you, Natalie. So for Robin, Natalie, or Monica, have any of your plans conducted any types of evaluation or surveys to learn about members' experiences? And if so, what have you learned?
Hi, this is Monica. I didn't do a survey, but I did connect via email with our members after the meeting to see how the meeting went for them. Did they have any hiccups? Did they how did it go? And from there, we did find out that we needed to send copies of all the presentations, all the handouts. We couldn't just have it online because some of our members were having trouble being on their phone and pulling up the presentations. So they preferred overwhelmingly to have me mail out hard copies of everything. And that way, if they were not comfortable or if they couldn't find something on the computer, or if they were just calling in, they had everything in front of them and could follow the meeting more closely.
And this is Robin. I can also echo, we haven't necessarily done any official surveys with the members. We do save time at the meetings, especially at the end. We allow at least a 15-minute session to talk about, hey, what would you like to be discussing at these meetings? What do you want to have on the agenda for upcoming meetings? Just to make sure that they're getting their voices heard in terms of what types of topics want to be covered at these meetings. So we're trying to be very responsive and make sure that the members are benefiting from these meetings as well as CareSource. And the other thing that we found is truly demonstrating that we're using their feedback and making a difference within that organization and taking action, I think has been the biggest satisfier with the members. Each meeting we start off by saying what we've done with the feedback at the previous meeting, and a lot of times we're able to, show them whether it's member communication materials that we've developed based on their feedback. And I think the best, most rewarding part is when they see it going to all members in the mail or something online, or a new collateral that's being put out to all members that was generated based on their feedback. I think that's a truly satisfying moment, and I think that's something that really creates a lot of satisfaction with participating in the advisory councils. So I think demonstrating that you're using their feedback is really one of the secret sauce to success.
And this is Natalie. So pre-COVID, we did do a paper survey for all members who are attending every single meeting. At the very end, we would give them a survey and ask questions about satisfaction with the meeting, what aspects of the meeting they liked most. So for us, because we are still testing out different formats, and we asked them if they liked the scan engagement, so the amount of scan staff in there and talking with them, the open discussion format, the breakout session or focus group styles, the activities, et cetera, so that we can get a taste of the types of things that kept them engaged. And then we asked them what they didn't like about the event, and also asking about their likeliness to attend one of our meetings in the future, so that we know if they didn't like the event and they don't want to return, then we would leave them off of the outreach list for the following sessions in the next years. And then the last question we always ask is, do you feel like your feedback is valued at SCAN? And that's one of the ones we consistently ask on every one of our surveys, because at the end of the day, that's we're hoping to show with our actions that our member feedback is truly valuable to us.
Thank you, Natalie, and all of you. One last question then, kind of piggybacking off of that and showing that importance. So COVID-19 has kept plan staff and leadership very busy, lots of competing priorities. How have you been able to keep momentum around using member input and feedback going? So Robin, Natalie, Monica, any of you can start.
This is Monica. I think in some cases, member feedback is even more important right now because this is a new situation for all of us. And so more than ever, we need to hear how this is affecting our members and how is it affecting things that maybe we thought we had settled or organized or were running well, but how is it easy for them to get their prescriptions now? How are they doing getting to their doctors? There's so many questions. It's kind of like a whole new world, and we need their help to help us navigate it and to provide the best service for them. So more than ever, we are depending on our member advisory committees at this time.
Yeah, this is Robin. I'll echo that. I think one of the biggest opportunities is really having those conversations about what barriers are they facing now that they're in a COVID-19 environment. So I think, as much as we can try to predict as a plan, some of the things that the members might be facing and how we can best support them, I think the best thing we've been able to do is really directly ask them what kind of barriers are they finding, how is CareSource doing at addressing some of those barriers and opening up those insights to what additionally can we be providing in terms of support to the members.
This is Natalie. I agree with Monica and Robin there wholeheartedly. And also, I think a way to make sure that the focus is still on advisory committees while everyone in your organization is scrambling on other competing priorities is partnering with other departments to put on advisory committees and topics that concern other departments. And maybe those departments are working on initiatives and programs that are in the making that are missing the member voice. And really reaching the leaders of those departments and incorporating them and collaborating with them to put on an event that benefits everybody.
This is Mary. I wanted to add something. One of the meetings that we had, one of the members, she was taking care of or assisting taking care of her parents who have COVID-19. So it's not just what the member is going through personally, but it's also life goes on and all the things around you. So I think that, reaching out just to have someone to talk to is important.
Thank you. Thank you for adding that, Mary, too. And thank you, everyone, for your responses. All right, at this time, we're out of time. If you have more questions, you can email us at ric@lewin.com. The slides for the presentation today, a recording and a transcript will be available on our website shortly. Lastly, I do want to mention again that the Zoom tips document that Robin discussed earlier, that Mary was speaking about, is available for download. We sent the link in the chat. It's also on the same webinar registration page. And again, thank you so much, Robin and CareSource, for allowing us to share that with the audience today. Thank you, everyone, so much for joining. Really appreciate all of the speakers and all of the insights that they shared today. Please, for the audience, please complete our brief evaluation so we can continue to deliver high-quality presentations. And if you have any questions, please email us at ric@lewin.com. Again, thank you so much to all of our speakers. Please stay safe and healthy, everyone. And thank you so much for your participation.
Ladies and gentlemen, that concludes your conference call for today. Thank you for your participation and for using AT&T Event Teleconferencing. You may now disconnect.